Welcome to this webinar. I'm Nancy Kassam-Adams, and together with Ann Kazak, I co-direct the Center for Pediatric Traumatic Stress. And Julia Price is a psychologist at the center and led the development of the materials that we're presenting here. Our center is a partner in the National Child Traumatic Stress Network in the US. We focus on the impact of illness, injury, and medical experiences for children and families. We create tools and resources for families and for healthcare providers, and we work closely with providers and organizations to promote trauma-informed healthcare, especially in hospital and emergency settings. And we're very glad to share these tools for emotional coping for healthcare staff and hope that you'll find them useful for yourselves and for the colleagues that you may be helping to support. This webinar is in 3 sections. After a very brief introduction by Ann Kazak and myself, Julia Price will lead you through the toolkit itself, and we'll end with a few tips about putting this into practice. The slide set that presents the TECHS tools, the slides that you're going to see in section 2, can be downloaded for your own use at healthcaretoolbox.org. And the webinar has these 2 aims. As a whole, it can help prepare you to support others at your institution. It'll introduce you to a model of how to use the slide set and how to present these tools as you help others work through them. But another way to use this webinar is to view section 2 on its own. And you could use this recording as a basis to work through these tools as a group or even as an individual. And we do want to note that we may post occasional updates of the core TECHS slide set. So check healthcaretoolbox.org for the latest version. And this webinar is using the version dated April 9th. All TECHS materials and this webinar are free for everyone. They're freely available, and we hope that you'll share them with others who might find them useful. And we have a couple of target audiences for this webinar. First, of course, is frontline healthcare staff, and then also others such as psychosocial professionals who may be helping to support our frontline colleagues.
This is Ann Kazak. It's a pleasure to be here with you and to work with Nancy and Julia on this presentation webinar. As Nancy mentioned, this was prepared by the Center for Pediatric Traumatic Stress, part of the National Child Traumatic Stress Network. To give you a little bit of background on some of the model that we're using in this presentation, it came from an intervention that we developed based on cognitive behavioral therapy and family systems therapy that we use with parents of children with cancer. We think that the concepts and some of the tools will be helpful to healthcare and mental health care professionals as they deal with life-threatening situations. So what's in the toolkit or the TECHS program? As I mentioned, we have some concrete tools to understand and cope with the many stresses related to the current COVID-19 situation. The presentation begins with an overview of traumatic stress and a little bit of background on what we're currently experiencing with COVID. There is an optional self-rating of current traumatic stress reactions that you can do. Basically, that links through, Julia will talk more about it, but I'll link through to a rating scale if you're sort of interested in seeing what your current level of traumatic stress looks like. That can be a very helpful activity, I think. We're going to present 3 tools that are designed to facilitate emotional coping, and then at the end of the presentation are links to additional resources. So you may be asking, well, how can we use this? How can my team use this? It's designed to be used in several different ways. We want it to be flexible, to fit the time that you have available. We realize that time is very limited right now. So it's fine to stop and start, to do little bits or pieces at a time, and go at your own pace. This is meant to be helpful, not to be one more thing that you need to do. You may want to watch it on your own, or you may want to watch it and participate with other colleagues or with your team. Another thought is to participate in a group facilitated by someone else. Maybe, for example, a psychosocial professional at your institution. There may be a peer support or a staff wellness program or an employee assistance program to help you make the best use of this material. So let's get started. I'm going to turn this over to Dr. Price now.
Thanks so much, Ann and Nancy, for the introduction. And thank you all who are watching this webinar for the work that you're doing. And we're very much hoping that this presentation will be helpful to you. So who is this slide set for? We put this together in response to this rapidly unfolding pandemic, and designed it to be a resource for all healthcare staff. So that's inclusive of clinical staff, security, front desk, dispatch, environmental services, leadership, anyone who is working currently in healthcare settings. And this slide set was developed by the Center for Pediatric Traumatic Stress, which is part of the National Child Traumatic Stress Network. And like I've said, we hope that these slides will be helpful for healthcare teams, and we want them to be available freely, and they are, to all of you. And we hope that you spread them if they're helpful to others who might benefit from using them. If you have any questions or feedback for us, we'd love to hear from you. And my contact information is listed here on the slide. In our time together today, we're going to talk a bit about traumatic stress and how that relates to COVID-19 for healthcare staff, introduce an optional self-assessment, and then spend most of our time talking about the 3 tools that make up the TECHS program: the ABC model, steps to reframing, future orientation, and give you some resources in addition to this. So the goal of this slide set is to provide you concrete, usable tools for healthcare staff, and that these tools hopefully will support your emotional coping in the face of this very challenging, stressful situation in healthcare settings. So I think many of you will find these points very familiar. We are currently experiencing a worldwide pandemic, and it is a quickly changing situation. And our healthcare systems are being overwhelmed, and professionals are being asked to change their roles, perhaps to duties that they have not been in quite some time, or perhaps that they've never been in, and are anticipating and or experiencing ethical dilemmas around using resources for patients, while also worried about their own safety and the personal protective equipment that's available to them. Healthcare staff might become infected themselves and are worried often about their own families and potential need to self-quarantine, which would remove them from supporting colleagues and families. Some quotes from some of the frontline staff that we have had a chance to connect with are listed here and are about concerns about their loved ones. So some include, I'm even having a hard time being home with my family, worried that if I get too close to them, I may be getting them sick. My roommate's dad made her move back home with her family because I'm an ED nurse. I feel terrible. I wouldn't be able to live with myself if someone I love got sick because of me. Some more quotes here about the emotional impact and safety concerns for frontline staff. Mostly I'm upset that we have to get special permission to use proper PPE, and when granted permission, we have to reuse it. It feels wrong and unsafe. I'm in one of the high-risk groups. I wake up every morning searching for some indication that I might have this virus. I count the days from when I could have last been exposed. Then I go to work again and start from the beginning. I'm having a hard time sleeping. I keep waking up dreading going into work. So what do we know from past experiences and some emerging studies about COVID-19? Well, first and foremost, we know that you're not alone. It's really common for healthcare staff to be experiencing this kind of emotional stress and distress. So studies back from the SARS epidemic in 2000s, certainly healthcare staff were experiencing at that time traumatic stress, anxiety, depression, and sleep problems. And years after the SARS outbreak, healthcare staff did not show increased levels of mental health disorders, but continued to experience burnout and general stress. And some early studies out of China are showing some similar findings, that healthcare staff are reporting traumatic stress, anxiety, and depression at similar levels to the general public, and that they are also showing sleep problems that are greater than the general public. And those who are most at risk as healthcare workers are those who tend to be worrying about their family members at home and who have chronic illnesses or mental health histories. But some things we know might buffer against some of that risk are when healthcare staff are provided support from the hospital and with PPE coverage. So what does traumatic stress look like? There are categories of symptoms of traumatic stress that are listed here. So the first of which is re-experiencing. This is an experience of where the thoughts about COVID-19 or a particularly distressing event pop into your head at unwanted times and frequently. Avoidance is another, where you are trying to avoid thinking about the distressing experience or being near things that might remind you of it. There can also be changes in the way you think and feel. So suddenly feeling a lot more scared, angry, having thoughts about kind of the world is a scary place, which is an understandable thing to be thinking around COVID-19. And that there tends to be an increased arousal. So kind of jumpiness, difficulty focusing and sleeping, and just kind of amped up. So it's not unusual to have some or all of these reactions during an unfolding stressful situation like COVID-19. Some other emotional responses that you might notice for yourself, for your peers, for your family members include those listed here: irritability, feeling emotionally detached, hopelessness, social withdrawal, fear, diminished self-care, feeling ineffective or apathetic. In terms of secondary traumatic stress, this is defined twice here. So it's a response to being exposed to trauma that is experienced by other people, often in your work. So the International Society of Traumatic Stress Studies defines secondary traumatic stress as the changes helpers experience in their identities, worldviews, and spirituality affect both the helper's professional relationships with clients or patients and colleagues and their personal relationships. So there are risks in terms of your role as a healthcare staff person. All healthcare staff are at risk for secondary traumatic stress, even when we're not in the midst of a pandemic. And that witnessing the suffering of others around you and potentially the death of others, if that's patients or other staff or family members, certainly put healthcare staff at risk for traumatic stress. The lack of clarity about the future and an ever-changing and worsening situation contributes to that risk as well. Healthcare staff are also part of their own families and have those roles as right now, as well as their professional roles. And they may be a caregiver for your own children, a partner, or caring for an older family member, and having concerns about care for children and older family members that is accessible and that feels safe. And healthcare staff are likely also concerned about becoming infected themselves. So in all of these roles, healthcare staff are at risk for traumatic stress and might also experience other emotional challenges around anxiety and depression. So what are we hearing from frontline staff as this pandemic unfolds? There are some themes that seem to be emerging in some initial conversations we've had around worry about working on the front lines and bringing COVID-19 home to a family, concerns that they or their colleagues will become infected, distress about not receiving enough support for their own health and wellness, including access to personal protective equipment, and discomfort in taking on new and potentially unfamiliar roles at work. There's some more quotes here directly from healthcare staff. My kids usually run to me when I get home from work every night, and now I have to tell them they can't. It breaks my heart. My wife and I both have to see patients. We have no choice but to expose our kids to this virus. We are doing everything we can to protect them, but it puts a cloud over every meal, every hug. every bedtime story. So you might be wondering, am I experiencing this? Am I having some traumatic stress reactions as a healthcare staff person right now? And one thing you might be able to do here is take this option to gauge your own reactions. So we have provided links to an evidence-based assessment that will help you check your own stress reactions. It is based on a tool that measures current traumatic stress reactions in adults, and we adapted it for use during this evolving pandemic situation. Now, if you have gone ahead and downloaded our PDF from our website, you can look through these slides that way, and there will be a live link here to click to go to an online tool that will allow you to rate your own traumatic stress reactions and will automatically score and give you a response of where you fall in terms of your score. Another option, again, if you have downloaded the slides on your own and can click on these links, is to do this offline measure, which is an appendix of this slide set that we're looking at now. I'm going to show you, so if you click on this will bring you to slide 78, and we'll show you the same thing that you would see in the online version. So what you're asked to do here is consider how you've been feeling recently related to COVID-19, and then to respond to each of these items on a scale from 1 to 5, from not at all to very much. And there are 19 items that you would rate, and then you would sum up the score of those 19 items to find out if you are having significant reactions. So if your sum of your items is 56 or higher, that would be one indication that you're having significant reactions. In addition, if you rate, give yourself a rating of 3 or higher on item number 20, that is also an indication that you are having a significant reaction. So once you have done that, you can click on this and go back to our presentation. So once, if you choose, that is, to rate your own reactions, it will give you a sense of where you fall. And here's some information about what to do based on your score. First, universal self-care. Everyone can benefit from learning more about coping. And this is why we developed the Toolkit for Emotional Coping for Healthcare Staff. And we also have additional resources that are good for everyone, regardless of your current level of traumatic stress reactions. If you find that you are scoring in a range or having responses that indicate a significant reaction, having significant stress reactions or any reactions that worry you, we do encourage you to contact your employee assistance program. There are evidence-based psychosocial treatments that often are effective for folks and might be available to you through telehealth or online. Okay, so we are going to get right into this toolkit now. So the Toolkit for Emotional Coping for Healthcare Staff includes 3 tools, and these are evidence-based tools that will help you understand and manage different adversities, and they're designed for you to be able to use them over and over again as needed for new or recurring stressful situations. It takes an interpersonal and team-based approach, so while it certainly can be used by you alone, we do find that it can be even more helpful if you can use it with your colleagues, trusted colleagues, that is, your team. You might choose to do it with your family or your partner. The tools are based on cognitive behavioral therapy skills and skills for groups and families. So how to use TECHS. This is a toolkit. You can pull these tools out when you are experiencing some distress or noticing some traumatic stress symptoms. So the tools offer a process that support your path to a more positive emotional place. Just like a hammer and a nail will not fix your fence for you, unfortunately, you will have to actively use these tools to cope more effectively. And ideally, you'll use the toolkit with others, so with your colleagues, and work together to bolster your relationships. So we are going to go through each tool one by one. And we're making another note here again about this is available to you individually or as a team. So the first tool is the ABC model. And we're going to start by slowing things down a little bit and thinking about the current context. So why are you in healthcare? Take a few minutes or so just to think about why you chose this profession. What drew you to it? What, if any, reservations have you had about this career choice? What are the best parts of the career that you chose? And what are some of the most challenging parts? And you might choose to pause now and return to join us later. We'll move forward to the ABC model. So we're going to take a little time to understand your thoughts and your feelings and your behavior. And this tool is going to help reflect on where you are emotionally in this moment and how your feelings, beliefs, and behaviors all relate to how you're doing in terms of your well-being. This is what the complete ABC model looks like. What we recommend at this point is to work through this form on your own or in your group by either using a blank piece of paper or opening up a new blank document on your computer. There are also blank ABC forms in Appendix B of the slide set if you have downloaded it from our website. So we will walk through one by one. A is adversity. So we'd like you to think about an event that has been particularly upsetting to you recently in this moment. So it's helpful sometimes to be a little more specific. So examples of different adversities that you might choose could be you're having so many patients at once, you're working outside of your usual role, you are feeling as though you're not able to support your children at home, or maybe not able to help your partner or family at home, or feeling emotionally isolated from family. In order to help these tools kind of come alive for you, we're going to walk through two different examples across all of the tools. So this is the first example here, example A, which is actually a personal example for me. Thought it might be helpful to have a genuine example to share with you all. So the adversity is my father, who's 73, has a number of different health conditions that really put him at risk. For example B, we have used the feedback that we have gotten from frontline healthcare staff to develop another example using their words. So this adversity might be, I'm being exposed to COVID-19 without proper PPE. So let's move on to beliefs. What thoughts are you having about that adversity that you chose to focus on? So what are you saying to yourself about this adversity in private? What, and some examples that you might be helpful to you of different beliefs or thoughts that you could have about the adversity are things like, I can't handle this stress, I'm ineffective at work, I'm not a good colleague or partner, the situation has no end. So again, to help you understand this model a little more, another part of the example A, so my personal example here is, I'm having some beliefs about I can't protect my father. He is at high risk and he might die. In example B, this frontline healthcare worker might be thinking, I'm going to be infected. I might get someone I love sick. Someone I love might die because I brought COVID-19 home. So if you're ready to move on to consequences, we're thinking now about the outcomes or consequences that are related to the adversity that you chose and the beliefs and thoughts that you're having about that adversity. So we'll take these one by one across the different kinds of consequences. So first, how are you feeling as a result of this? In thinking the way you do about the adversity, how is that making you feel? Perhaps angry or sad or worried, perhaps a whole mixture of feelings. And then what are you doing when you feel that way? So based on how you feel about the adversity and the thoughts you're having, are you showing or hiding your feelings? Are you making healthy choices? And finally, what about your relationships? How's all of this impacting others and how you relate to them? So how is the way that you are reacting to your adversity and the way that you feel and what you're doing affecting your colleagues, your loved ones, your patients? So again, let's go back to our examples here. So for example A, I'm feeling very scared and very worried and sad about my adversity around my father. And as a result of this, I find myself calling my parents quite often and trying to follow social distancing rules very carefully, and also trying to get other people to follow those rules very carefully. And I tend to kind of think more slowly. I'm not quite as with it as normal. And then in terms of my relationships, this is causing me to have some conflict with some family and friends, some disagreements, and then feeling a bit more distant or isolated from some of them because of that. For our second example, for the frontline healthcare worker, this person might be feeling terrified and perhaps so on edge that they are also irritable at times and sad, and perhaps also feeling lonely, being separated from others. In terms of their actions, they might be wearing as much PPE as they can possibly find and washing their hands and clothes and any mask they might have repeatedly, not sleeping well, and potentially being quite distant, at least physically, from loved ones. And how this is impacting his or her relationships, they may be having less patience with their children and feeling more distant or isolated from their loved ones, and potentially more easily frustrated with colleagues or situations at work. So we've said multiple times that you can certainly do this as an individual or with others. And it's important to think, how might the ABCs that you just did be different for other people in your life? So what might the people on your team at work or in your family have chosen for their adversity? And what would their beliefs have been about that adversity? And what kinds of consequences might they be experiencing because of those? In addition, have you shared any of the adversity or beliefs or consequences with others? Are they aware of your ABCs? So we're going to move on to tool number 2 now, steps to reframing. So during the ABC tool, you identified a specific adversity, developed a greater understanding of beliefs and thoughts and consequences. And so now that we have a sense of your current emotional state and perspective, we're going to try to help shift those consequences to a more positive place. So these are the 4 steps to reframing, all outlined here. You might choose to now turn your blank piece of paper over to respond in writing to these 4 steps, or go to the next page on your electronic document. There are also blank forms of the 4 steps here in the appendix B of our slide set. So we'll walk through these steps one by one on the next slides. So step 1, accept the uncontrollable. This can be very difficult to do. And so the first place to start is to list what parts of the adversity you chose to focus on are truly beyond your control? And what is it like to give up that control? How does that feel? And what do you think about that? So we're going to stick again with our same examples. So from example A, in terms of the uncontrollable, I'm not in control of if my father gets COVID-19. I'm also not in control of if other people follow all the social distancing rules the way that I think they should. And I'm not really fully in control of my ability to operate at full capacity. In terms of our example B, our frontline healthcare worker, he or she is not in control of whether they get COVID-19 or if they have enough PPE, unfortunately. They're also not in control of the decisions that their institution makes. So these are challenging things to realize are not in your control. So what we want to do next is try to focus on what is in your control. What aspects of your adversity can you focus on that are in your control and that might help to improve the situation, might help you cope better, might help you feel more in control, and ultimately might help your patients, your colleagues, your family, and your friends. So for example A, I might be able to focus on my own social distancing behavior, which I am in control of, or my own use of coping strategies, and my interest and ability to be helpful to other people. Those are fully in my control. Our frontline healthcare worker, for example B, might focus on his or her own careful use of the resources that they do have. So masks and washing and social distancing, and also focusing on the time that they do have with loved ones and finding a way to optimize that in terms of connecting and having that be a supportive experience. They might also focus on working to use any coping methods that help them feel better. Now, step 3 is acknowledge your own strengths. So think back to a time when you have dealt with a challenging situation in the past, which all of us have, and write down a few notes about what helped you get through that. What strengths did you leverage to work your way through that difficult situation? And what strengths did the people around you have that they brought to help a challenging situation in the past? That might be the medical team that you work with, or even your family. How might their strengths contribute to moving through this? And which of these strengths can be applied to the current situation? So for example, I might use my ability to communicate my thoughts and feelings, or my ability to be helpful to the people I love. There's some strengths that I bring to the situation. So for example B, the frontline healthcare worker might leverage some of their strengths around their own experience and training that can support their ability to keep themselves safe, or as safe as possible. They might also use their ability to connect with other people and support their colleagues and their loved ones. This particular step, it can be really helpful to do in a group. And if you are doing this alone, it can be helpful to think about what would your closest friend, closest colleague, partner, parent say your strengths are. Sometimes it can be easier to have other people tell us what our strengths are than to identify them ourselves. And you can do that in a group setting or kind of imagine it if you're doing this individually. So step 4, if we are able to accept the uncontrollable, focus on the controllable, and then apply the strengths that you've identified, how might you be able to think differently? how could you potentially see the adversity that you're thinking about right now differently? And then how might that impact others? So based on this exercise, might there be a more positive kind of take-home message for you? So in my example, if I'm able to accept that I am not in control of whether my father gets sick, and that I cannot be the social distancing police as much as I want to be, but instead focus on my own behavior, my own use of coping strategies, and use my strengths around communication and being helpful, I might be able to feel a little less worried or have my worries be more manageable. And I might then also feel more connected to my loved ones and have that support. Our frontline healthcare worker, for example, B. So if they can accept this challenging thing to accept around not being in control of having PPE or getting sick, and focus instead on the resources they have and optimizing the support they can gain and the strength they can gain from their loved ones, and leveraging their strengths around their training to be safe in a healthcare setting, and to connect with others. Perhaps they might also feel a little less anxious, and they might also feel more connected, even if that connection might look a little different than it would outside of this pandemic. So we're going to move on to the final tool, tool number 3, future orientation. So I want you to take a look at this COVID-19 roadmap. We're going to talk more about this and work through this tool as well. And this map will be in smaller form on the next slides, but I just want to give a chance to take a look at all the parts of this map. So dealing with this pandemic is kind of like a journey. There was a beginning, there will be a middle, and there will be an end. And along that path, there'll be individual challenges and patients and families that will be a part of your whole journey. And sometimes we get stuck focusing on the particularly stressful experiences. And then it can be hard to think more broadly, but it's more useful to do that. So this tool is going to help us think, widen our lens, if you will, to include the past, the present, and the future across the entire journey. So if you're looking at this map, where would you say you see yourself on this roadmap right now? And why is that? And once you've had a sense of where you might be and why, the next thing to do is to think about where you were on the roadmap in the first or earlier portion of this journey. And how do you think your position on the map impacts your ability to cope, your daily life, your relationships? So we're going to give some examples here as well. So for example A, currently on this roadmap, I feel as though I'm in the roundabout. I'm kind of going in circles, trying to get people to follow social distancing rules carefully. Now, when COVID-19 started, or kind of when this began for me, I thought I was probably right before the roundabout on this road. I was figuring out what was happening with COVID-19. I wasn't quite sure of the severity of what was going to happen here or around the world. For example, B, our frontline healthcare staff person, currently they might be feeling that they are at that first detour, trying to find a way past that barrier, which might be not having enough PPE and just experiencing this daily risk of being infected with COVID-19. And it might be that the starting position for this person was way back at the start, noted on the map. Seeing COVID-19 coming to their country and anticipating it causing significant suffering and fear. So now we want to consider a time in the future. And this will be an individual kind of choice about how far in the future you can or want to look. It might be a couple days, a couple weeks, or months or years that you're thinking about. And whatever future time point you feel comfortable thinking about, where are you on the map at that future time point? What is happening for you at work and at home? And what is your daily life like? And what will help you move to a more positive place by this time point? So example A, my future position on the map, I thought about 2 months from now, I might be at that lookout point, reflecting on what we've been through and seeing a more stable, predictable future for all of us. And in that way, perhaps feeling less anxious, less concerned about my father, and closer to my loved ones. In terms of our example B, our frontline healthcare staff member, they were comfortable thinking about 1 week from now. And potentially they might be at the roundabout, finding more of a routine and some level of predictability in their day-to-day life. Kind of at this point, understanding the train they're on, so the level of severity of infections that are in their area, at their institution, and just kind of going around and around with this routine of managing COVID-19. And that perhaps being able to find a way to be more present with loved ones during their time away from work would be more feasible at this time. So we're going to talk now how to use these tools, how they might help build team resilience. So we've said this throughout, but it can be really helpful to use these tools with your colleagues around a challenging situation. It can help you all understand your different frames of reference about that adversity and see the variability and consequences that result from your different viewpoints. You might have some similarities and some differences. And it's a way to help other people explain and then understand everyone's feelings and actions and kind of appreciate those different viewpoints. And by using our reframing tool, you have an opportunity to focus your energy on the strengths that each person brings to the situation. So we are, as we said, recommending that you use these tools with your team, and that team might be your unit, your closest friends at work, your family, and that you set a time to meet, again, with appropriate social distancing or virtually, where you can have a small group where you feel comfortable sharing this kind of information. So it's important that you do choose colleagues with whom you feel comfortable. And when working together, again, the goal here is to just understand different perspectives. There's not a correct way to look at a situation or a correct adversity or belief or consequence. That the benefit here can come from having an understanding of all the range of ways of seeing things within a healthcare team. So moving forward, using these tools. So what we would really highly recommend also is keeping these tools or this toolkit handy. So save these slides, slides that you can download from our website, in a place where you can easily find them. You might choose to print parts of them out that are most helpful to you and keep them where you can see them regularly. And then consider pulling them out when you're experiencing a lot of stress, or perhaps you might choose to do this at some kind of regular interval, alone or with others. And particularly, it can be helpful to pull them out when you are feeling stuck in a high stress situation. Again, these tools offer a process to cope, to help you reach a more positive place. And they really require this kind of active engagement for them to be useful. as an example, I am a psychologist and worked on these slides and this toolkit along with Anne and Nancy for some time over the past few weeks, and thought very carefully about all this, but did not until this week, a couple days ago, actually tried out the tools myself related to COVID-19. And it turns out they were helpful to me. So sometimes we don't even take our own advice and take the time to slow down and take the time to really think through how we're feeling and use the tools available to us that we know can be helpful. So other resources in addition to what we reviewed today are available on our website. So as we said earlier, there are opportunities to complete a self-assessment if you choose to do so. There's also an app available for free that you might choose to use. It was designed for healthcare providers in the military and providers in other settings that may find it relevant. And what's nice about this app is you can keep track of your score over time around ratings on secondary traumatic stress and burnout and compassion satisfaction. And there are other tools within this app also to support coping. More resources on our website offer trainings around trauma-informed care and secondary traumatic stress. We also have a number of resources for families around COVID-19, both in English and Spanish. And this is some information about our center that worked to develop all of these resources in collaboration and support from National Child Traumatic Stress Network. So as we saw earlier, Appendix A in the slide set that you can download from the website includes the self-assessment. That is an offline option, self-scored. So as we saw earlier, we walked through these slides. Appendix B is where you will find blank versions of the tools. So the ABC model, the 4 steps to reframing, and the COVID-19 roadmap. So now we want to kind of switch from the meat of TECHS, of the Toolkit for Emotional Coping for Healthcare Staff, and talk about how you might use TECHS at your institution. So for those of you who are watching and might end up in a position where you would lead the implementation of TECHS at your institution or be part of that implementation process, whether it's with groups of people or individually, we are going to offer some tips for how to do that. So first, we would say prioritize the staff needs. So remember that staff will vary in terms of their preferences around privacy and comfort in terms of sharing or engaging in these kinds of conversations about their emotional well-being. And then also understand that all the staff that you are trying to work with are currently experiencing likely a high level of stress, whether that's related to COVID-19 and or other stress they might be experiencing. So there are a lot of competing demands on staff that really should be considered to make sure that you are being helpful and not adding to a list of to-dos. Logistics around implementation. So consider schedules that of the folks you are trying to work with and what time might be the best for them to walk through these tools. And remember that some staff will have fewer options for paid time spent on these kinds of things around learning and professional development. So again, flexibility will be key, and using as many virtual options as possible can also be helpful. We also really recommend that you offer TECHS to all healthcare staff. So not just clinical staff, but staff from all walks of healthcare settings. This is staff from environmental services, food service leadership, front desk. Everyone who's working in healthcare settings is likely at risk or high levels of stress and would all benefit from this kind of universal approach to improving self-care. It's really important also to talk about confidentiality and what level of confidentiality there is if folks are deciding that they feel comfortable sharing how they're feeling and the consequences of their feelings and each piece of the toolkit here. It's important to help participants feel connected as well. So if you are using virtual tools to have meetings now in your setting, it can be helpful to have spaces available to be seen so that you can feel that connection a bit more than just looking at a shared screen or talking on the phone. So now some common questions and concerns. So how quickly should we go through TECHS? I would say just be careful not to go through too quickly. In this webinar, we move at a pretty good pace, anticipating that folks have the opportunity to pause and return to the webinar as needed. It's also important that participants try out the tools during your time together. We can often get kind of rushed or frantic, especially when we're feeling stressed, and then we don't truly engage. So making sure to take the time to write down responses as much as folks might not be interested in that, finding ways for them to really engage with the material and respond to each part of the tool that you're going through is important. So depending on the situation, you might also consider multiple briefer sessions so that it feels more manageable than the full toolkit at once. In terms of optimizing potential benefits, I would really recommend considering allotting time at the end of your work through TECHS to talk about how can the folks you're working with use the tools moving forward. So you have gone through and reviewed the ABC model, steps to reframing, the future orientation map. Now, as the people you're working with are leaving you, how are they going to use this the next time that they're feeling high levels of stress? And that will vary, so it can be helpful to have those conversations. Consider giving your own examples. It can help other people feel more connected as a group. If you are comfortable sharing your own adversity or one of your own adversities and walking through all the tools with them. So what are some formats for delivering text? So you might consider having standing meetings that people can join if they have time. So that might be on a weekly or bi-weekly basis, varying days of the week or times of day, or having regular check-ins with a particular medical team or group who have reached out for support. Text could also be delivered by staff who are part of your employee assistance or peer support programs. And it's really important to think about who you're grouping together to optimize comfort and participation. So thinking about the dynamics of the people who might be in the room at the same time, how comfortable do you think each of them are talking openly about their emotional experiences in front of the others there? So what are some options for using the ABC model? This model can sometimes be challenging for folks to understand, and particularly can be difficult to identify beliefs. So one tip that might be helpful is to think about jumping from identifying the adversity to focus on to the consequences first, and then returning to thinking about the beliefs after that. So how do you use text with an individual? So even if you're just working with one person, it's important to do your best to try to bring in other viewpoints as part of the discussion. So spending time in that visit with them, time with them, asking what adversities others in their life might be identifying, other colleagues, other family members, what would they be saying? And then to solicit what strengths those other colleagues or loved ones might identify in the person you're working with, and what strengths would they identify in those people. So by bringing those kinds of questions into the mix, you can make an individual application of TECHS feel a bit more group-based. And so how do you offer TECHS to a group if you have that opportunity? I would say be sure to spend time having everyone connect at the beginning. We started before the ABC model by having some time to reflect on why folks chose this profession, why they're in the healthcare setting, you know, and challenges of that profession and benefits of that profession. And that might be, for example, a way to connect at the beginning. And it might depend, again, on who is in the group. So developing rapport among those group members and understanding any kind of pre-existing relationships as the person leading the group can be really helpful and important. And to then, for each tool, encourage collaboration in smaller groups if you have a very large group, and some level of discussion as well. So if you have more questions or comments or feedback, again, we would love to hear from you, either at our email through the Center for Pediatric Traumatic Stress, or you can contact me. My email is listed here. And again, as a reminder, this webinar was based on our TECHS slides that were dated April 9th, 2020. On the website where you can download these slides, we may have additional updates after that date. So please do check back. And thank you so much for your time and for all of the work that you are doing.